I don't know how many times I've heard a patient say, I wish I'd done it earlier. I think that's the important thing to remember. It's over quickly, that they've got a short recovery period of time as well, and they get back to their daily activities quite quickly as well. So infection after laser are much lower than rates of infection with contact lenses, so obviously in the long term a much more safer option. It's a one-off payment. It's perhaps an expenditure, a large expenditure at the one time, but over the years, if you count it up with contact lenses and glasses, etc., it certainly will pay for itself in the long run. But obviously, the sustainability issue, and the impact of contact lenses being flushed down the toilet, and so you negate that by having laser. In older patients, perhaps with varifocals or bifocal glasses, falls and trips can be an issue. So obviously getting rid of their glasses from that point of view would make it safer from them when they're walking about, especially if they're a wee bit unsteady on their feet. And so from that side of things, there's also a benefit. Yeah, you point out the benefits of having laser eye surgery, the freedom it gives them. A lot of patients will say that things like going swimming with their kids is a nightmare, and they can't see the kids. They're not supposed to be wearing their contact lenses in the pool from an infection point of view. So these are the things that you highlight to a patient so that they can see how it's going to work for them on a day-to-day basis. Sportsmen, obviously, you're playing rugby, football, you get smacked in the eye, you lose your contact lens, you're no use. So obviously there's a gain there as well. Yeah, I mean, your contact lens can fall out your eye anytime, and if you're doing something at high speed like that, then you are going to struggle. I mean, certainly, obviously, at the moment we know that the NHS waiting lists are out of control. Obviously, Optical Express offer patients another route to having cataract surgery, and it will allow them to have it when it suits them, much quicker. And then they can, a lot of patients are still working, so if they've got cataracts, they're maybe not able to work, so it'll get them back to work much quicker.